Health Report. Shamela Pullen takes a closer look at the H3N2 influenza virus.
Family physician Dr. Orville Nemart says he's seeing an increase in influenza A cases in his practice. Influenza is a viral infection that typically occurs during the flu season, which runs from October to March. The strain currently being seen is the H3N2 subtype of influenza A.
But this one has been labeled a super flu because it sort of steps a little outside of what we're used to and outside of what we were prepared for this season. In explaining that, we prepare flu vaccines for the flu season starting from as far back as December of the previous year. And the flu season starts like in September for us in the Northern Hemisphere. The projections which were made based on the strains which were being seen, this strain of flu is a little outside of that.
H3N2 is highly contagious and is often associated with more severe flu symptoms and increased hospitalizations. Children, the elderly, and people with chronic illnesses are most at risk.
The additional stuff we've seen is a bit of vomiting in some persons, some diarrhea, but the sequelae, meaning what happens after the acute infection, is what's proving to be more important, I find. Persons are developing asthma symptoms, and this is persons who sometimes have never had a history of asthma, and also in some of our older patients are getting lower respiratory tract infections, in other words, pneumonias. And it's not presenting like what we would expect for pneumonia, is what people would call the walking pneumonia. They're coming in with just a persistent cough or persistent malaise. And sometimes it's only when you listen to the chest or maybe do an x-ray that you pick up that there is something going on there.
Treatment for the flu focuses on managing symptoms and seeking medical care. Individuals are advised to rest, stay hydrated, and see a medical doctor if symptoms worsen or persist.
There is still a percentage cover which you will get from the flu vaccine, and there is still cross-reactivity which you will get. So persons who have been taking their vaccines over the years and so on, even if you do come down with the flu, the symptomatology is much less than what you'd expect if it is that you had not been immunized over the time.
With your health report, I'm Shamela Pullen, wishing you good health.